Hello and welcome to Trevor Phillips on Sunday. This is one of those sobering mornings when we who cover Westminster perhaps need to cast our eyes outwards from London and remember that politics, if it serves any purpose at all, should be to protect our people and to make their lives better wherever they live. The short and cruel life of Arthur Lebinjo Hughes, murdered by his own stepmother in Solihull, is a severe challenge to politicians. It adds a brutal chapter to the toll of child killings over recent years and once again raises serious questions about the capacity and capability of our social services. We've known about the problem for decades, but still can't seem to stop it happening. Politics is also, the Prime Minister says, when it's not about COVID, about levelling up. We've been talking to children in one area of the north of England where his vision may be taking shape, providing fresh hope for a new generation. The question is whether that can be replicated. If it can't, those red wall votes that Boris Johnson borrowed in 2019 could very quickly find their way to another owner. We'll be joined by guests from North, South, East and West this morning. We'll speak to the Deputy Prime Minister, Dominic Raab. The Shadow Environment Secretary, Jim McMahon, will give us Labour's view. Prominent statistician, Professor Sir David Spiegelhalter, will tell us more about the threat posed by the OMICRON coronavirus variant. The government released its white paper on social care this week, so we'll ask the Chief Executive of the Four Seasons Healthcare Group, Jeremy Richardson, what it could mean for the care home sector. And I've been to the former coal town, Goole, on the Humber in East Yorkshire, to see what levelling up might look like in practice. But first, let's talk to the Justice Secretary and Deputy Prime Minister, Dominic Raab. Good morning, Deputy Prime Minister.
Good morning.
I'd like to start with the murder of Arthur Lebinjo Hughes. Can you confirm that there will be an inquiry into this murder?
Yes, good morning, Trevor. Look, as a father of young boys myself, as a parent alone as Justice Secretary, I can't begin to imagine how anyone could be that cruel. Let me tell you exactly what we're doing. We've had those sentences for the two parents. The Attorney General's made clear she wants to have them reviewed, where we have a mechanism for doing so. There'll be a local safeguarding review which will look at the local authorities' actions, whether any lessons could have been picked up earlier, whether any warning flags could have been put up earlier. And the Prime Minister's made clear, as well as that, we want to see how social services and the local authorities liaise with the criminal justice agencies and what lessons further we can learn. This is the second case I've dealt with this week. I saw Tony Hudgell and his parents, Paula and Mark, another very, very sad case of child cruelty. We've immediately, and I announced, steps to increase the sentences. The most vulnerable in our society need to have the maximum protection.
Well, as you said, this is not the first time. We can go back through the roll call. Kaylee Jade Priest, Peter Connolly, Victoria Clambier. There's a list of horror that goes back more than 2 decades. And we already know part of the problem, don't we? Not enough social workers and perhaps not enough good training for those social workers. It's right to review, it's right to inquiry, but couldn't we get on with doing something about that? Because we know already that's part of the problem.
Well, there's a multi-dimensions to this. There's the fact that the individuals responsible for any of this cruelty could be so callous. There is also the local authority response, and I would say that I think the social workers on the front line do an incredible job. As part of the pandemic response, we've invested close to £5 billion in giving local authorities the support they need, because one of the things we know about lockdown, whilst lots of families enjoyed a bit more time together, for those that are the victims of domestic abuse, it has been a very serious time. Some of those risks have been magnified, and we're taking the action we also need to take, as I announced with the announcement this week of Tony's Law, tougher sentences for those who would commit this unimaginable cruelty on children.
But isn't this rather like the Victoria Clambier case, where the inquiry by Lord Laming, way back in the early 2000s, spotted, I think it was 17 different occasions where the social services could have intervened but didn't for a variety of reasons. And this case, Arthur Labinjo Hughes, echoes that precisely. Isn't that really where we ought to be focusing our attention right now?
Look, I think it's part of the picture. I don't think there's a silver bullet answer to this. I mean, you've got to ask how anyone could commit this kind of unimaginable cruelty, why we've got families that might countenance, let alone commit such abuse. It's right that we look at the criminal justice end, and in between that, I think the job of social workers, particularly those looking at children of at particular risk, we need to learn the lessons. Of course, it's very difficult for social workers on the front line.
Especially if there aren't enough of them.
Yes, but this is often reduced to the question of resources. I've just explained that during the pandemic we've put in, I think it was 4.8 billion, close to £5 billion, but they do an incredibly difficult job. It's very finely balanced. On the one hand, they need to make sure they've got the engagement, the relationship, that those families talk to them. On the other hand, of course, the top priority has got to be looking for those risks, reading the signs, which may only be subtle, and then with the benefit of hindsight, be more obvious. But at the time, I do think, though, we've got to make sure, if you like, a more precautionary approach, which looks at the risk to those particularly vulnerable young children and see what more we can do to read those signs earlier and better.
All right, let's discuss the precautionary principle on a larger scale. We're talking now about COVID. Last night we got a new travel ban. Actually, you should have applied the precautionary principle a week ago, shouldn't you? It's too late.
Well, in relation to the Omicron variant, we actually acted quicker than I think any other country in the world, perhaps with the exception of Israel, in putting travel restrictions on people coming from countries, particularly in Africa. In relation to the PCR tests for people coming into this country, look, I know that that's a burden for the travel industry, but we've made huge strides in this country. We've got 80% of those over 12 double jab now. We've got a third of the country with a third jab or a booster. We've got to take the measures targeted forensically to stop the new variant seeding in this country to create a bigger problem. We're going into this Christmas in a far better state. We can enjoy Christmas this year in a way that we couldn't last year. That is a testament to the vaccine programme, in particular the boosters, which are protecting us through this winter, the colder months, with also the risks from the variants. So actually I think we have done the right thing. We've taken a balanced approach, but we're always alert to extra risks that take us back, not forward.
Your number one priority is still to protect the NHS. There's some data emerging this morning which says that 90% of those in hospital, in COVID beds, are unvaccinated. And that takes up 20% of critical care beds. Wouldn't it make sense, if you want to protect the NHS, to do something about that? Other countries are now moving towards mandatory vaccination. Shouldn't we be making sure that people who basically are endangering others suffer some consequences before they take up that 90% of beds?
Well, look, first of all, can I say that, again, if you look at the data, yes, there's been some extra transmission of the virus because of Omicron, but actually, if you compare the data this week compared to last week, and we look at this very carefully, hospitalisations are down, deaths as a result of COVID are down. In relation to occupancy in NHS and the beds that you described...
Which is pre-Omicron.
Yes, of course. Look, we are absolutely clear people should get the jab. They should get double jab. They should get the booster when it's available. I'm not convinced that wholesale straitjacket mandatory vaccinations, other than in those settings where it's really required, like social care and for staff working in the NHS in hospitals, I'm not convinced that would be effective. Whether it's fair and right and morally the right thing to do. We've got to make sure that those who are vaccine hesitant, if you like, have got the confidence to do it. And anyone that is reading the data, reading the efficacy of what the vaccines can achieve, including against Omicron with the latest research that we had published on Friday, this must be the right thing to do. So I set the premise of your question, which is anyone that isn't having the vaccine is putting themselves, but also other people in our community at risk. I'm just not sure.
And they're lengthening that 6 million person waiting list.
Well, then you've got to answer me that question. I'm not convinced it would be an effective thing to do to say everyone has got to compulsorily have the vaccine. What we want to do is say, get it done. It's the right thing to do. You should have the vaccine. It's irresponsible not to have the vaccine. That's the approach we're taking.
All right, look, on Omicron, to put it at its most blunt, not that many people have died compared to what we've seen with Delta. There is a case for saying that what you're doing is a bit of an overreaction.
Well, we'll always get the Goldilocks criticism of too much, too little. I think we've taken the right approach. We're focused on the vaccines, the boosters. We've got a third of the population over 12 with a third vaccine injection or with a booster. But we are taking the measures, and we've seen that with travel, and I know some people will feel overburdened by that, to say, look, we are going to prevent the variants, Omicron and others coming in, and what's called receding in the UK, because we've got to make sure that we bank the progress that we've made, go into Christmas, have a great Christmas, and go into the new year bouncing back. We've got the economy expanding, jobs are up, wages are up. We've got to, as well as make sure we protect everyone's health and lives and safety, also make sure we protect livelihoods. So I think we've taken a balanced approach.
I was hoping you wouldn't bring up Christmas, but you have. So let me just ask you
Why were you hoping I wouldn't bring up Christmas?
Because I now have to ask you the tabloid question. It's a Christmas season.
Yeah.
Some ministers are telling us that we can have parties. Some are telling us that we can't do what's natural under the mistletoe. Now, I see that the Conservative Party chairman, Oliver Dowden, is going ahead with the party headquarters Christmas party. Have you sorted out the Ministry of Justice Christmas party? You're going to have one, I take it?
Well, first of all, the rule's very clear. People can go in and have Christmas parties. Of course, employers will want to think common sense about how they do that. We don't want to substitute for that discretion and that common sense. We won't be having a Ministry of Justice-wide Christmas party this year, but we'll be having, I think, appropriate drinks at a smaller scale.
What does an appropriate drink look like in this context? And I'm not... you may want to reflect on what happened last year, but... What does an appropriate... And this is quite a serious point, actually, because lots of us are being asked to join our colleagues. What is right and what is wrong here? What's advised?
Well, so the right thing to do is for every employer to take a common sense view. We want, let me be absolutely clear, government wants people to be able to enjoy Christmas this year. That means people should feel free to go and enjoy those celebrations, and every employer will think about the right way to do it. And I'm the same as anyone else.
So you're not really offering any guidance?
No, we are. We're saying the guidance we're offering is we say, first of all, you can have those Christmas events. Second of all, we want to allow the common sense discretion of employers to make the right call.
All right, let's move on to your own particular area. You are signalling today, and I think this week, that you're going to get tough on county lines. You're really trying to make some progress on some issues of crime. Let's just start, if I may, with the incredibly important issue of rape.
Yeah.
And you're preparing to offer greater rights to people who've suffered that particular crime. What are you actually proposing on rape?
So we'll set out some proposals later on this week, but first of all, we're going to be publishing scorecards, both for general crime but also for rape, which means we can see exactly where the system is working and exactly where it isn't working, whether it's at the police stage, the prosecution stage, prosecutions getting to court. I'm hosting a tech summit tomorrow. One of the things that we're looking at in relation to the rape review, and we're going to be publishing our 6-monthly update on where we've got to. That was an action plan announced in June. We're going to be showing how we've made progress. One of the things we're looking at is how tech can drive up prosecutions, whether it's the ability to get swifter readouts from mobile phones from victims that come forward, so they're not deprived of their mobile phone for long. We know that that's something that undermines confidence in coming forward to the police. One of the particular things that I've been looking at is what's called Section 28, pre-recorded testimony for the victims of rape. We've been trialling this in a number of Crown courts. I actually think this is something we need to roll out nationally. I want to look at the right way to do that. The advantage that it has for a victim is that they have the opportunity to give their evidence without being through the additional trauma of the glare of the courtroom. And that can secure more prosecutions, but it also can encourage earlier guilty pleas. So I think it's the right thing to do, but it's also an effective way of driving up those prosecutions.
The tech will help. And I know you won't particularly like to get onto this territory, but let's be clear. The CPS, the Crown Prosecution Service, say that the appallingly low level of rape convictions is in part due to the fact that they don't have enough people. The cops say that the their inability to gather evidence and bring forward successful cases is also down to a lack of resources. Where's the new money to make this work?
Well, actually, at the spending review, we secured extra money for the Ministry of Justice. I've got 12% real-term increase, the largest for a decade. That means that we can fund, and the attorney is responsible for the CPS, but we can fund the prosecutions, and in particular, in my area, the independent sexual violence advisors that support victims through. Because we know if victims just say they don't want to go through with a trial, not only is that terrible denial of justice for them, but we don't get the prosecutions and bang up the people, lock up the people that are responsible. I think there's also something, I mean, you touched on it, there's a little bit of finger-pointing that goes on in the system. You have operational independence for the police, the CPS, of course, for the judiciary. One of the things that we've been trialling and rolling out is what's called Operation Soteria, which means that the prosecutors and the police look when they get a case, not just constantly scrutinising the victim if they made inconsistencies in what they said, but the rigour goes on scrutinising what the suspect has done and what the suspect has said. That, along with the other measures, is helping to drive up confidence in the system. And again, we want to roll that out nationally too over time.
The low conviction rate does not inspire confidence in women. We know that. And one other thing that we know is a problem is that women are reluctant to come forward and report rape or sexual assault because they do not have confidence in the way they will be treated by the police. We only have to say the words Sarah Everard to explain what that means. What are you doing to restore that confidence?
So there's a whole range of things that we'll announce this week. But let me just give you a flavour. So first of all, these criminal justice scorecards, which will be for generic crime, but also for rape particularly, and in the new year we'll break them down for localised areas, will show not just victims, but the whole of a community, the public, where we're getting it right and where we're getting it wrong. I think that's important. I'm also going to be announcing this week a consultation on a victims' law, which will put victims in relation to rape and sexual violence, but also across the board, at the centre of what the criminal justice process does. I think morally that's the right thing to do. I think justice is there for the victims. I think also, frankly, from an operational point of view, making sure victims have got confidence in the system, hang on through, not just to report it to the police. We've actually seen an increase in reporting to the police, but are willing then to willing then to go to trial. That is the way we give them the confidence, but we also, frankly, from a data point of view, from a results point of view, drive up the number of convictions.
But the issue here is police behaviour. What are you and your colleague over at Home Office saying to the police about the way they behave?
Well, in the aftermath of Sarah Everard and the issue around Wayne Couzens, there are all sorts of reviews that have been put in place to see both in relation to whether the warning signs should have been heeded earlier about Wayne Couzens, but also things like systematic practice, cultural points about whether we are whether sexism, frankly, is being dealt with properly in the police. So those things are being dealt with. I think this issue of the cooperation, the coordination, the collaboration between prosecutors and the police, though, is absolutely critical. We respect the operational independence of both, but Operation Soteria shows you how a more collaborative approach, more transparency, frankly, a little bit more evaluation and assessment of what's going on, seeing the breakdown, where those local police forces and prosecutorial teams are innovating and driving up results. We want to say, if you can do it there, why not spread that best practice across the country? I think that's what gives victims hope.
OK, I just don't need to... I mean, this is a politics programme, so let me just ask you one question about politics. You won in Bexley, but actually part of the reason that you didn't do as bad as you might have done is, or that you did do as badly as you did, rather, is that Nigel Farage's party, Reform Party, took 7% of the votes. They kept their deposit. Are you worried about the return of Farage?
Look, we worry about delivering for the people of this country, whether it's on vaccines, the economy, criminal justice. But I would just say on Bexley and Sidcup, for a government 2 years in, we took over half of the
That isn't
vote.
the question I asked you. I asked you about Nigel Farage. You're worried about Nigel Farage coming back to politics.
But I think that for us in government, particularly as the Conservatives, we should be focusing on the people's priorities, which is not worrying about the political competition, is worrying about delivering for the people of this country. In Bexley and Sidcup, we secured, again, 2 years in for a government from the last election, time where historically we come under a lot of pressure at by-elections. We secured over half the vote with this great candidate, Louis French, who I will campaign with, and we're going to continue focusing on the people's priorities.
Dominic Raab, thank you very much indeed.
Good to talk to you.
Right, well, let's get Labour's take on all of this. And I'm joined by the Shadow Environment Secretary, Jim McMahon. Good morning, Mr McMahon.
Morning.
Is Labour going to support the government's plans on how to deal with this latest wave of Omicron, including the pre-travel tests and so forth?
Well, of course, it was the Labour Party who were calling for pre-testing to take place because we're very concerned that the government consistently throughout the pandemic have been very late in making the calls that are required to keep our borders safe, very late in terms of trying to spread control the spread of that virus. And what we want to do is to make sure that we don't jeopardise the vaccination rollout. The worst thing in the world, after all the sacrifices that we've made, is that a new variant comes in and completely takes the rug from under that programme. And so it's very important the government get a grip. It's very important the government take swift action. And frankly, it shouldn't be for the opposition to keep continually one step ahead of the government. The government needs to take control themselves.
Yeah, but getting a grip... would that involve, or should that have involved, bringing in plans to work from home or social distancing, or indeed a ban on Christmas parties? Whether or not you're ahead of the government, is that what you wanted?
We've been very clear that common sense measures that taken together keep us safer is the way to go. And so, of course, if a workplace is unsafe, then action will need to be taken. But many workplaces can be safe, providing that appropriate action is taken to maintain social distancing, to make sure that people are supported to self-isolate and to take sick leave if they need to, and that includes decent sick pay to allow people to do that. We've been very clear that common sense interventions are far better than a blunt instrument in this. And we want to make sure that after the sacrifice that we've made, and listen, most of us last year at Christmas were adhering to the rules, and we made sacrifices. We didn't see our loved ones, we didn't mix, we didn't have parties in the office, we adhered to the rules. After all that sacrifice that we've made, we want to look forward to this Christmas. And the only way to do that is for the government to have a very clear plan, for them to kind of get on with the booster vaccination rollout, and to make sure that throughout the course of that the messaging is really clear. Because the worst thing in the world is that the government say one thing but then do another. And people look at the actions of the government and they get a confused message.
I'm not entirely clear about your own message here. Would a clear plan involve saying to people you should not have Christmas parties, for example?
Well, we've been very clear for the government to bring forward the plan based on the scientific evidence and advice, and it's got to be a coherent plan. We've been very clear that we do not believe that Christmas parties should be cancelled. We believe that hospitality has been through a very difficult period, and it's very important for hospitality that we continue in the way that we want to. But that can only happen if we're not undermined by new strain variants coming into the country that completely take apart the vaccination rollout.
So what about vaccine passport for big events? Would you have insisted on that?
We've always wanted to take a common sense and evidence-based approach. And of course, it wasn't that long ago that we were saying very clearly that for large gatherings, that testing should be taking place to make sure that if people were carrying COVID, they weren't able then to spread it across a large group of people. But we've also been very clear that it's got to be a balanced approach. And so, you wouldn't necessarily need it for the pub or for the restaurants. We don't want to have unnecessary rules in place that really undermine confidence in hospitality, confidence in going out over Christmas. But equally, we do want people to be cautious. We are not on the other side of this yet. There's still many cases that are being identified. There's still many people who are in hospital through COVID, and we don't know yet the extent of the new variant. So, cautious, common sense approach is what's needed.
Well, I don't want to spend too much time on this, but what you've told me is you will back the steps that the government's taken. You would not do more than they have said that they want to do on Christmas parties. You would not introduce vaccine passports. You're basically telling me exactly the same as a government minister would tell me, which is to say, let's be cautious, let's be commonsensical, and so on. What's your problem with what the government's done then?
Well, first of all, it was Labour that called for the pre-departure testing to take place, and the government were late in coming to that conclusion themselves. It's the Labour Party who's calling for 500,000 booster vaccinations to be administered every day, and at the moment the government's only reaching 370,000. And so we are very clear about what's needed. We need to make sure that people are resilient and have the booster vaccination, but the government needs to do far more to make it accessible. They need to be investing in pop-up facilities, whether that's in campuses, on the high street, in workplaces, to make sure that it is accessible and people take that booster vaccination. By doing that, of course, they're more resilient to the virus. But equally, the vaccination programme as it stands could easily be undermined by a new variant that completely undermines it. And so that's why it's really important that we have strong borders. But in doing so, make sure that we understand the implications of that for aviation, for tourism. Of course, we will begin to see consumer confidence diminish. It's very important the government have a single plan to make sure that common sense interventions on one hand fully see through the implications of that to make sure that our economy and our society is supported.
We've been in the north this week, Mr. McMahon, and you, of course, you're an Oldham MP. You'll have seen the impact of Storm Arwen. Do you think that what's been done is adequate? And frankly, do you think, as some people have said to me in the northeast, if that storm had hit the southeast, do you think that the response would have been the same as it has been?
Well, I'm in Oldham today, but I was further north earlier in the week when I went to County Durham to meet residents who are directly affected by the power outage. And that was now 6 days into the storm when I visited. One of the first things I did in my new role in the Shadow Cabinet. And when you hear the real lived experience of people, it beggars belief that in a national emergency, it wasn't considered a national priority. Where was Boris Johnson? Why wasn't Cobra called to deal with this? Why has it taken a week for the army to be called in? And I firmly believe, had this have been the case where 20,000 properties were without power in Surrey or in London, the government would absolutely have treated it with more seriousness. And I think for people in County Durham who I spoke to, they felt isolated, they felt angry, and they felt forgotten.
Michael Gove, who is the Levelling Up Secretary, has been talking this week, we understand, about introducing greater devolution to different parts of England, including, for example, the idea of what I think he calls governors, which are sort of like state governors in the United States. You were a local authority leader. Would you favour that sort of devolution?
I do think we have a very fragmented system of devolution in England in a way that is confused. It's not as clear as Scotland, Wales and Northern Ireland. And the truth is the creation of the Metro Mayors has given sub-regions a voice, but the counties are voiceless. And actually, if you look at the way the government are directing money, aside from the red wall seats that they want to support, quite a lot of that is being sent through mayoral combined authorities at the disadvantage of many of our counties. And so the government do need a single plan to make sure that governance, accountability and investment in England is where it needs to be. Whether governors are the right approach, I'm not sure. I think, Keir Starmer's been really clear that when we talk about the power imbalance in this country, it's because people in the communities where they live don't believe they've got power over the direction of the places where they live. And so before we start talking about new politicians being created, we ought to talk about whether people feel able to drive the direction of the places where they live, in the communities where they live. And I think for many people, they don't feel that way, particularly, by the way, because the government continually take power away from local people. I mean, just look at one of the biggest things that actually affects your area is physical development, building work, construction. Well, actually, the government have taken that power away from many communities in favour of developers who quite often are not working in the interest of the local community. And so if we're talking about where power sits, it should be absolutely rooted in the communities where people live.
OK, well, let's talk about power. Let's talk about how you get your hands on some. You came second in a by-election in Bexley this week, which is encouraging. You had a 10% swing from the Conservatives, which is pretty good. But according to John Curtis, who's the great authority on these things, even a 10% swing repeated all over the country still wouldn't give you a majority. There is a massive mountain to climb for Labour, isn't there?
So we understand fully the challenge ahead of us, but also we reflect on the progress that we have made. You know, in 2019, the election was a disaster. You know, people weren't willing to even consider Labour being in government, but now Keir Starmer as our leader has earned us the right to be heard. But now what we need to do is to convince people that we've got a plan, an alternative plan for this country. And that's very much the kind of framing of the new shadow cabinet. That's very much the framing that Keir Starmer is keen to get out there. And I think actually now that restrictions have eased and we're able to get around the country more, we are able to speak to people in the places where they live in a direct way that I do believe is cutting through. And actually, you know, the Bexley by-election for the Tories was a disaster. Not least of all, it would have put, you know, if that was seen through in a general election, it would have put Labour very close to majority government. But the truth is that every day that passes, the Conservatives are getting worse. They are being found out. People see them for what they are, which is it's one rule for them and it's another for everybody else. And people are fed up with having that liberty.
At your first shadow cabinet meeting, did you actually talk about the issue of your pathway back to power, which for most observers only lies through two pathways? One, that Nigel Farage takes enough votes off the Tories to lose them many of the constituencies that they now hold, or that you do a deal with Nicola Sturgeon. Did you discuss at the Shadow Cabinet how it feels to be beholden either to Nigel Farage or Nicola Sturgeon, or both, to get into number 10?
Well, not really, because the conversations that we have at Shadow Cabinet are not defeatist conversations. They are positive conversations. They're ambitious conversations, and we are ambitious not for ourselves,
I'm talking about being realistic.
For the people who live here. And so we're absolutely clear that with our path to government, with a plan that's being set out, that by the time we get to the general election, that we will be in a position to form a majority government. That's the project. That's exactly what we're in politics to do.
Jim McMahon, thank you very much for your time this morning. Right, let's get more on the Omicron variant now and find out more about exactly what kind of threat it could pose to us. I'm now joined by Professor Sir David Spiegelhalter, who is a leading statistician based at the University of Cambridge and the author of COVID by Numbers. Good morning, Professor Spiegelhalter.
Good morning.
What are the numbers telling us about the risk that we face from this new variant?
It's a very difficult situation because we haven't got a lot of data yet at all, almost nothing from this country about what the risks are. South Africa, there's data coming out showing pretty strong evidence of increased risk of transmission, and some evidence about people going to hospital that it may actually be milder, but we haven't got enough data yet to be able to say. It doesn't look as if it's, really severe if you get it. I think that's about all we can say at the moment.
So at the moment, your view is keep calm and carry on to some extent.
Yeah, we're at a very tricky time. I mean, the policy has led to a very delicate balancing act for months, essentially, with high case rates and what apparently seem to be tolerable hospitalizations that have been coming down recently, and even deaths coming down. But a very strange situation where cases in young people are going up, especially in London. Cases in old people are still coming down, and that's the booster effect. Boosters we're being saved by boosters, essentially. They are extraordinarily effective. If you've had, double AstraZeneca and then Pfizer, you're more protected than you've ever been, right from the beginning, right from when you had the initial vaccinations. I know I shouldn't sell I'm a statistician, I collect data, but I do like stories as well. And somebody was tweeting out about their 93-year-old grandmother who got COVID, but she was triple vaxxed and she just had a runny nose. I mean, I know that's only one person, but we do know that they're saving very large numbers of lives. I think it's a real problem. I mean, first of all, there's a big push now to get boosters out. I'm not quite sure why we're only doing that now. It was so clear that these are the lifesavers. We had to get them out, but at last it's happening. But the benefits have been very poorly communicated. If your hospitalization protective, your protection against going to hospital has dropped, say, from 97% to 91%. Well, it doesn't sound very much, does it? And topping that up, well, is that very important? But if you flip it round and look at your vulnerability, your relative vulnerability has gone from 3% to 9%. The opposite to the 97 and the 90, the 97 and the 91. Then that means your risk has gone up 3 times. So just that bit of waning has massively increased your risk. And I think if things were being communicated much more about that, and the fact that the boosters massively reduce your risk of hospitalization and death, then the take-up might be even stronger.
Well, I'm with you that statos ought to be allowed to tell more stories, because statistics often tell us the greatest stories. But one story which I think we don't quite know the end to is this. Even if we are still just dealing with Delta, this winter, what do you estimate to be the bigger risk? Delta, COVID, or flu? What should we be more worried about? Well,
to be honest, flu is very low at the moment. Not as low as last year. It was almost none last year at all. But it is actually very low at the moment because we're still taking lots of protective measures. We're not mixing socially anything like as much as we have been normally in a normal winter, where flu might kill 10, 20,000 people. So actually, it's great that everyone's been jabbed. I've had my flu jab, but flu at the moment does not look like the main risk over this winter, apart from COVID. I think the big risk over this winter, even before the new variant came along, was just the standard risk almost of the NHS over winter, which is the huge pressures that are on it, which we can see, and that's only made worse by COVID cases requiring more resources, and of course the huge backlog that's built up because of the pandemic. So flu I don't think is such an issue over this winter.
What do you make of the story that's emerging this morning about the proportion of COVID beds that are being occupied by those who are unvaccinated? And I guess there are a couple of questions here, but to start with, is that really significant? 90% of the beds allocated to COVID, which are 20%, I think, of critical care beds, are occupied by people who are unvaccinated. Is that really a big issue, or is it marginal?
It's not true of hospitalizations. The majority of people in hospital with COVID have been vaccinated. And that's exactly what we'd expect when nearly everybody who is vulnerable to, particularly vulnerable to COVID, have been vaccinated. That's not saying the vaccines don't work, it's just saying they're not perfect. Intensive care is different because the people who go into intensive care are much younger than the standard person who's at risk with COVID and goes into hospital. They're highly selected, and in there's the majority of beds are unvaccinated. I personally, my opinion is, I think that's very unfortunate indeed that these people are not vaccinated, and they and their families might possibly be regretting that decision. But they have to be treated just like someone who smokes is treated in hospital like everybody else, and so there is a duty to treat them. But I think it's very unfortunate, and that any effort to increase the take-up of vaccines is valuable. And of course, that's both to protect people around you, but it is just to protect yourself.
Looking at the history of these things, do you think that there's a point at which you reach a sort of a ceiling on the levels of vaccination, and that there is always going to be, if you like, a recalcitrant minority that just won't have it?
Absolutely. You won't convince everybody. There'll always be there'll always be a small group of people. And in a way, to some extent, they take advantage of what the rest of the community are doing. I'm not really, I don't comment on policy. I think it'd be unfortunate perhaps if there was all the vaccinations made mandatory, though, because it makes martyrs out of people. And just every effort should be done to get people to volunteer to be vaccinated. But it won't cover everybody. No, that's impossible. And even if it did, even if we're all vaccinated, this virus is going to be circulating. It's not going to wipe out the virus. We're not going to reach that. And so, in fact, although it would be great if more were vaccinated, it's not like that's going to eliminate the epidemic.
Can we talk about the government's steps thus far? Looking back at what has been done in previous waves, we now have the travel ban, we have exhortations to behave in a commonsensical way, and so on. If what we fear about Omicron is true, is what's been done so far enough to stop it?
Again, I'm not going to say exactly what should be done because I'm not an infectious disease expert. I'm not going to say, I wouldn't dream of saying what the policy should be. But as the previous interviewee said, it's best to be precautionary when there's so much we don't know. I mean, it really looks like this Omicron virus is more transmissible. We don't know whether that's because it's intrinsic property of the virus that makes it more transmissible, or whether it's because it can get around, the immunity people have got either from having previous infections or from vaccinations. So, and there's a wide range of different combinations of those that could still lead to more transmissibility. There's so much we don't know. And when we don't know, it's better to be safe than sorry. Now, what that means is another matter. This is just like last year with the Alpha variant, this is a terrible time for a variant to come along when it's probably the next 2 weeks are probably some of the highest risk periods with a lot of indoor socializing that we know is extremely high risk. And so it's appalling timing. I'm sure the government would love not to disrupt Christmas. What happens after Christmas, of course, is another matter. I mean, the travel restrictions at the moment are only going to slow things up a little bit, possibly, or to some extent, but they're not going to stop it, and it's going to come in. And we obviously everyone will do their best to stop it spreading. But, the new year is quite likely to see some quite, a lot of challenges to face. And as SAGE have said, that could very well mean more stringent measures. I think I could mention working from home, which so far has not been recommended, but that is known to be extremely effective at halving the number of close contacts people have. And in the end, it's how close, it's how many people you're breathing over. I should say, if people want to go onto the British Medical Journal, we've just got a nice interactive animation there where you can click on a little image and show I'm wearing a mask, I'm singing, I'm 2 meters away, the other person's not wearing a mask. What's my risk of transmitting the virus if I've got it? And you can change all these things and see them wobbling around and what is an effective measure. And I think that's quite informative. It's certainly actually changing my views of what perhaps I might do.
Well, that sounds like a good Sunday afternoon alternative to playing Fortnite. But just quickly, if I may ask you this, you've probably got a better fix than most on the progress of these things. In reality, have we just got to abandon the notion that this thing will go away, but accept that it will be endemic, that we are going to have to live with it in the same way that we live with flu?
I'm taking the judgment that other people have made, but yes, it's not going to go away. I don't think there's no way this could be eliminated. It's going to be spreading around. People have suggested this Omicron is the sort of an endemic variant that might just be, we might just have to, this is one we might have to live with for some time. And we're going to have to get used to it. And that could very well involve, as people have said, top up vaccines. I don't know. I get very sad at the thought of us, having to have, changing our mode of socializing and things like that, and traveling. So it's unclear what that will mean in terms of our lives, except I think we will be vaccinating, getting boosters for the foreseeable future.
Sir David, thank you very much for your time. Boris Johnson swept into power off the back of the Red Wall landslide in 2019, and he's vowed to repay those voters. A government white paper on levelling up in Britain is due this side of Christmas. But what will it take to help rebuild northern towns and cities? And what is the potential political fallout for the government if they fail to deliver on their promises? I've been talking to people in the town of Goole in East Yorkshire. The old market town of Goole in the East Riding of Yorkshire, home to Britain's most inland port. Once at the heart of Britain's coal export drive, like many northern towns, Goole has suffered from a steady post-industrial decline. But now, at last, there are signs of a revival.
This morning, we're going to do a maths test.
The 90-odd pupils here are a mix of those from families who have lived in Goole for generations.
What about you? What's on your house?
And newer arrivals, attracted by a renewed sense of optimism in the area.
We have families that come to the school from all different backgrounds. We have very sort of successful business-minded families, and we have families that come from areas where work is difficult to get, and perhaps income streams have been hard and choices have not been great for them.
And just watching them this morning, to be honest, you wouldn't be able to tell which is which.
You can't tell which is which because they've got lovely, vibrant personalities, and we try and instill through our school high aspirations and hope and the fact that, you know, the world is their oyster, really.
And it isn't just the head teacher who's confident about the direction of travel. When you all grow up, what do you want to do? Do you want to stay living here in Goole, or would you move away?
There's two things which I'd like to be, can't make my mind up. It's either a teacher or a train driver.
Why train driver?
Because I've loved trains ever since I was born, and it's just my favourite thing.
And just a few miles away, along the Humber, they're building the platform for Goole's future prosperity. The German transport company Siemens is developing this site into a £200 million manufacturing facility. They have orders to build the next generation of rolling stock for customers including the London Underground. And the company is dug in for the long haul.
We are a business to community, being in the community, working in the community, taking the knowledge we have, imparting that into the community, inspiring people, giving people a pride in a sense of place. I think that's been lacking in many places. Giving people that they're from some place, they should be proud of that place, to know the heritage of the place, but actually also to think what's important, what's achievable, to change the narrative around places like this. That's why this is so cool. We have a customer in London, TfL, who's buying trains for us that'll be manufactured here in Goole by a company that is in the community, supporting the community.
While everyone welcomes what Siemens is doing here in Goole, there are those who think that it should not just be left to private enterprise to drive the North's industrial regeneration. Government too has a role to play, but there are calls for that political power not to be hoarded in Whitehall, but devolved to regions like this. There's a lot of cash that's going to go into levelling up. It's not just the amount of money, but it's how it's spent. Who decides?
The challenge here has to be that Whitehall can't decide. Whitehall can do many things well, and it can probably deal with the big businesses like Siemens, but when it comes to those more detailed discussions, a civil servant in Whitehall can never be across the detail of what's going to bring local SMEs, for instance, to the buildings behind me, which are going to be the clustering of businesses around this particular factory. And that does require local leaders to be more empowered, and it requires industrialists to have people there who they can deal with.
You lot are too bright. Whatever the government's plans and future timetable for delivery, there is no doubting the impact one company is having here. Who can tell me about Siemens?
It's a factory that makes trains and vehicles like this. They work really hard to make these trains and make different types of vehicles, and they try really hard, I guess.
Siemens' promotion of a primary engineering programme to help get these kids trained up in the necessary skills for jobs at the factory is already proving to be a big hit.
If big companies like Siemens keep investing in places like Goole, then I'm really optimistic, because they give opportunities for young people to invest in their own area if they want to, because there's the structures there to do that, and they can work at any level. They can do top level work within their own community, but they can also aspire to work internationally or go all over the world, or have big ambitious ideas about being successful.
It's almost impossible not to be uplifted by the optimism that we've found here. And it's not just the jobs or the new infrastructure. It is the sense that this town has found a purpose again, and that it will have status and respect and even a bit of love. But to make levelling up work, this is going to have to happen in hundreds of places across the country. And if it doesn't, Boris Johnson and his government are going to pay a pretty high political price.
It's high stakes for the Prime Minister as well, because this is what he'll be remembered by. Does he make levelling up a reality? He wants it to be a reality, but can he push it through government? Can he push it through Treasury? And there's real question marks there. And a government that can't deliver more successful towns is a government that will have a lot of questions to answer at the next general election.
Boris Johnson has already marked his place in history as the Prime Minister who succeeded in his promise to deliver Brexit. A new government white paper on levelling up is due this side of Christmas. The Prime Minister wants to be remembered for keeping his promise to those who gifted him with a landslide. If he doesn't, the season of goodwill he's enjoyed so far in towns like Goole could rapidly freeze into a winter of discontent. A government white paper on social care was released this week, promising to spend more than £5 billion over 3 years. Boris Johnson's vowed to end the often crippling bills faced by many in old age, announcing a cap on care costs for adults in England from October 2023. So what could this mean for the social care sector? The Chief Executive of the Four Seasons Healthcare Group, Jeremy Richardson, is with us. Good morning, Mr. Richardson. How worried is the care sector about facing a winter crisis with OMICRON and everything else?
Morning, Trevor. I think the sector is really worried at the moment, not necessarily because of the threat faced by OMICRON, but because of the bigger challenges, the wider issues that we've got, which are long-term and not just in the moment.
So you think that there could well be a winter crisis as bad as it was last winter?
Well, look, I don't think the sector is going to collapse tomorrow, but it's gradually falling over. And the problem is that incrementally, you're seeing a decline in the quality of services. So if we look at the social care reform that's just been announced, I applaud the intent that the government has undertaken, because they are the first government in many decades to try to tackle the problem. The issue is that the execution is really disappointing. Somebody last week described it as an underpowered saloon car when what's required is a Formula One racing car, and I think that's probably quite apt.
I want to come to the social care reforms in a second, but before we do that, can I just ask you about the impact of the government's mandate that all staff should be jabbed? I know that you and some of your colleagues were concerned that this would have an impact on staff numbers. What do you know so far?
Well, look, I've been really clear, and I've said I didn't think that mandating the vaccine was the right thing to do, and I still think that that's the case. Well, unfortunately, that ship has now sailed. We have lost about 200 staff members, so that's 200 really hard-working members of team who are providing care to our residents on a day-to-day basis.
If I may ask?
200 people we think have left the business. So 49 people left on the 11th of November, so those are the people that we had to dismiss. But then you've got to take
total of what number? What is your workforce?
So we have 12,500 team members, 49 left on the final day, but we estimate that 200 left in the run-up. So in total, we've lost about 1.6% of our workforce. And what you've got to bear in mind is that at the time that we had to get rid of those people, we already had 95% of our team fully vaccinated, double jabbed, providing protection to themselves and also to the residents. So I think in a situation like that, what you have to do is weigh up relative risk. And the greater risk to my residents today is that I don't have enough team members to look after them and provide really good quality care than the risk presented by transmission of the virus itself.
So let's talk about the social care reform to see whether what the government's brought forward might help to deal with that risk. From what you said earlier on, you don't think much of it. It clearly didn't meet your expectations.
Well, no. I mean, as I say, I applaud the intent. So the Prime Minister has stood up and he's told the public that the social care issues are going to be solved. And if you're a member of the public, then you rightly believe that the problem has been solved, because that's what the Prime Minister has told you. The problem is that all that's been announced is a short-term funding plan for the NHS. So £36 billion is going to be raised over the next 3 years. 31.6 billion of that is going into the NHS. So only 5.4 billion is going into social care. That's 1.8 billion a year. And it's widely accepted by all experts that the sector needs between 7 to 10 billion a year just to stand still. So unfortunately, if you're going to announce that you're fixing social care, don't just fund the NHS. There isn't enough funding going into the sector. That's one of the problems. And the second issue is that it's not tackling today's issues. The money that we are going to receive in the bulk is coming in 3 years' time, and that's assuming that the NHS choose to hand it back over at that stage.
If I may, when I spoke to Mr. Sunak some weeks ago about this, his argument was that you couldn't spend that money tomorrow, and what you needed to do was to build it up so that in 3 years' time you're getting the bulk of it, and that over time that number would build up. Did you accept that argument?
No, of course I don't. I mean, that's a really convenient thing for him to say, because it allows him to justify not putting the funding into social care today that it really needs. So no, I absolutely disagree with that. The fundamental issue here is that the true cost of care, so what it costs to look after people safely and to provide them with a really good quality of life, is not provided by the local authorities. So if additional funding came into the sector now, what you would see is an increase in the average weekly fee provided by local authorities. And I absolutely could spend that money, because the first thing I'd do is I'd start to pay the team who are working so hard in our homes what they're really worth. At the moment, it's very difficult for us to do that because our revenues are capped by local authorities, which in turn are capped by the lack of funding provided by central government.
I mean, all round, it sounds like you are really rather despairing both of the current situation and also the impact of the government's plans as published in their white paper.
Well, look, I'm not despairing, because we are very fortunate, both as a company and as a country, that we have so many phenomenally hardworking people in social care. I'm despairing, but then I am despairing in the context of the finances, because I don't think we've solved the issues, and we will simply continue to see a deterioration and gradual erosion, if we're not careful, of the services that we're able to deliver to people. And I think we have to ask ourselves as a country, what is it that's important to us? Do we want to give our elderly people dignity and quality of life in their old age, or do we want to simply ignore them? And I think the risk is that unless we put proper funding into the sector, unless we really grapple with the issue, then we're just going to see a slow deterioration of the quality of service we provide. And I don't think that's morally right. I think we owe it to our elderly people to provide the best quality of care that we possibly can.
Thank you very much indeed for your time this morning, Mr. Richardson.
Thank you very much.
That's all that we've got time for today on Trevor Phillips on Sunday. I want to leave you where we began, perhaps remembering that the purpose of politics is to help people have better lives, or indeed keep their lives at all. And we'll remember this morning Arthur Libinjo Hughes. After the break, we'll be analysing what we heard on the programme from the Deputy Prime Minister Dominic Raab and my other guests. That's On The Take with our Deputy Political Editor Sam Coates. Stay with us.